Opening a hospital is harder than you think, especially if you want to offer quality care. In most states, you are obligated to obtain a certificate of need from the government, which involves presenting yourself before a board and proving that your community needs another hospital, and that you are willing and able to fund it all by yourself. The people on the board include senior administrators from already existing hospitals in the area, who want the competition from you about as much as a gunshot to the head. The 2010 Obamacare law prevents government payments to any hospitals owned by doctors, putting you at a disadvantage compared to existing commercial hospitals in your area that are taking Medicare and Medicaid patients. You also find that training your own assistant technicians on the site to take runaway tasks off the hands of your physicians and save patients money is not allowed, and you have to attend to patients with relatively trivial complaints because no one else is allowed to do it. You had hoped to offer mentorship programs to college graduates to keep staff costs down for patients and help graduates get a good start, but there are so few medical schools due to government restrictions on building them that it's hard to compete with more commercial hospitals when it comes to recruiting new talent. The cost of complying with all the reams and reams of government regulations your hospital has to conform to is also significant, and you have to charge patients and private insurance companies more to cover the cost of extra staff. The government forces you to keep open arms of the hospital that are unprofitable, and you end up having to compensate for the losses by overcharging in other areas. You invest in unnecessary imaging equipment because running patients through tests always proves to be very profitable. Subscribe Libertarian Facts.